Myla Joy Sigantoha, first-year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure for mixing insulin and administering subcutaneous injections. But before that, we're going to do an assessment, which is to assess the patient for any allergies. You need to check the expiration date before administering the medication and to assess the proper drug for the patient to avoid sites that are bruised, hard, swollen, and or inflamed. For the possible nursing diagnosis, we have acute pain, risk for infection, and injury. For the materials, we're going to be needing this disposable gloves, the prescribed medicine, sterile syringe and needles, alcohol prep pad. Since we're all set, let us start the procedure. Procedure number 1 is to verify the practitioner's order. Review an accurate list of all of the patient's medication and supplements and allergies. This ensures that the right patient receives the right medication. For procedure number 2, know the actions, adverse effects, side effects, and nursing responsibilities related to the drug that you are going to administer to your patient. This is to educate the client for the possible outcome effects of the drug. For the next procedure, you need to wash your hands. Since I already washed my hands, I am now applying an alcohol-based hand rub to prevent the spread of contamination or microorganisms. For procedure number 4, prepare, gather the supplies, and check medication, regular and intermediate insulin from the refrigerator. This helps to identify errors that may have occurred when the orders were being transcribed. Since we've already gathered the necessary materials for this procedure, we are now going to proceed to procedure number 5, which is to compare the doctor's orders with the medication ticket and the medication ticket with the medications itself. This is to ensure appropriateness and avoid errors. It is now confirmed. We are now going to proceed to procedure number 6, which is to check the expiration date, check for the clarity of the regular insulin and the cloudiness of the intermediate insulin. So now we're going to check the expiration date, which is on 14/1/12, and same as the intermediate insulin. We're now going to check for the clarity of the regular insulin and the cloudiness of the intermediate insulin. By doing this, it ensures the safety of the patient. We are now going to proceed to procedure number 7. Perform the standing 3 checks of the drug together with the medication ticket. You're going to do this when it is taken from the medication cart, before withdrawing the medication and after withdrawing the medication. By doing this, it ensures check the medication before you administer it to your own patient. So now we're going to check, since we've checked it a while ago after removing it to the cart or the refrigerator. Okay, so now we're going to proceed to procedure number 8, which is disinfect the rubber stopper of the 2 insulin and let it dry. This is to remove surface bacteria and prevents contamination. So we have here an alcohol prep pad. We are going to use different alcohol prep pad to each bottle of insulin. You need to clean these for 30 seconds each. And after 30 seconds, we're going to clean the other insulin using an alcohol. 30 seconds. And we're done. And now we're going to dispose the alcohol prep pad that we've used. And now we're going to proceed to procedure number 9, which is to remove cap from needle, aspirate air equal to the dose of the NPH intermediate or the insulin. By removing the air from the tubing, it ensures that the patient receives the right amount of dose of insulin. So we're going to do it on this one. Now I'm going to get the new syringe. Only touch here. And we need to put an air. Since we're going to put a 1 ml. And now we're going to proceed to procedure number 10, which is to inject the amount of air to the NPH, then inject the amount of air equal to the dose of the regular insulin to the regular insulin vial. And for the other one, and now we're going to proceed to procedure number 10, which is to inject the amount of air. Injection of an equal amount of air is required to prevent the formation of a partial vacuum when you're going to get the amount later that you're going to be needing. So now we're going to proceed to procedure number 11, which is do the second checking of the medication. But before that, we're going to set this aside first on a safety and sterile container. By doing this, you ensure that the right patient receives the right medication. And now we're going to proceed to procedure number 12. And now you need to withdraw the ordered amount of regular insulin by tilting the vial upside down. This is to ensure safety and appropriateness of the procedure. Now we are going to withdraw the ordered amount of intermediate insulin. This is to ensure safety and appropriateness. And now we need to proceed to procedure number 14, which is to remove the excess air until you see a small amount of insulin on top of the needle. This ensures that the correct dose of medication is being taken. And now we're going to proceed to procedure number 15, which is to recap the needle and place the insulin syringe on top of the medication ticket. This is to avoid contaminating the medication. And now we're going to proceed to the giving of subcutaneous injections. For the procedure number 16, we need to transport the medication tray with the alcohol prep to the patient's room. This saves time and uses our energy efficiently. So now we're going to do it. I'm going to set this aside. Let's go. Hi ma'am, good day. I am your nurse for today. I am Myla J.C. Cantoja. Pwede ko makabulos yung pangalan, ma'am?
Marlita Cantoja.
Kano sa yung birthday, ma'am?
September 28, 1963.
Okay, ma'am. So, karon, this is the procedure number 17, which is to introduce yourself and identify the patient. The purpose of this is to establish a good rapport and to know the capabilities of the patient to assist you while doing the procedure. And now we're going to proceed to procedure number 18, which is to explain the procedure and the actions of the drug. This is to reduce anxiety and stress and to impart knowledge to the patient. So, mag-inject na ko sa imong haog insulin, ma'am. It is used to control blood sugar in people who have type 1 diabetes, a condition in which the body does not make insulin and therefore cannot control the amount of sugar in the blood, or also in people who have type 2 diabetes, a condition in which the blood sugar is too high because the body does not produce or use the insulin po. So, okay lang po? Okay po. So, now we're going to proceed to the next step, which is to wash hands and don gloves. Since I've already washed my hands, I am going to apply a alcohol-based hand rub to prevent the contamination and the spread of microorganisms. Now I'm going to don the gloves. And after doing this, we need to proceed to procedure number 20, which is to select the site, which is on the abdomen, and disinfect the site. So we're going to choose it here, on this site. Ma'am, asa ka last time di-injectan sa imong shot, ma'am? Sa tikas. Sige, dili ata sa tikas side karon. So, this side. Disinfect with the alcohol swab. From center to outer. And let it dry. And after that, you're going to pinch the site with the non-dominant hand and insert a cotton between the third and fourth finger. This is to ensure safety and reduce anxiety for the patient. The cotton is on the third and fourth finger. Now we're going to pinch the site. And after doing this, you need to proceed to the next procedure, which is to remove the dominant hand, the cup, and this is to prepare the syringe before administering, and inject slowly and evenly the medications at an angle of 45 to 90 degrees. This is to reach the subcutaneous tissue and lessen the pain to the patient. And while we inject, count 1 to 10 after fully injecting the medication. Then you can remove the needle. This is to allow medication to diffuse to the surrounding tissue. One, two, 3, 4, 5, 6, 7, 8, 9, 10. And after that, you need to use the cotton from the non-dominant hand to gently swab the area. Do not massage. This is because massaging can force the medication to diffuse to the surrounding tissue. And now we're going to do an aftercare, which is to discard the needles that we use in a puncture-proof container. This ensures the patient's comfort and to discard the needles properly. To prevent contamination, now we're going to put it in a puncture-proof container and dispose. And now we're going to remove our gloves. And after removing the gloves, you need to perform a hand hygiene, which is to apply an alcohol-based hand rub to prevent contamination and the spread of microorganisms, and to ensure that the patient is at its comfortable state. Okay lang ano ma'am? Sige pa. So now we're going to proceed to procedure number 27, which is to evaluate and document the care that we gave to the patient. This is to monitor the client's progress. And since we're all set, do not forget the things that we use. Don't left them in the patient's bedside table. And that's it for today. Thank you for watching. Bye!